Care of the patient begins as soon as she walks into your facility. The administrative requirements should be attended, and it is very important to communicate sympathetically, as this may shape her overall experience. The waiting area should be clean and calming. She should be kept informed if there is any delay during her visit. The consultation should start with a welcome greeting and reassurance that her treatment and information will be confidential. A medical assessment will involve taking her obstetrical and gynecological history and a physical examination. Establish if the patient has any underlying medical conditions and document if she is on any medications, including herbal medications. It is important to ask if she has any allergies and avoid those medications. A general physical examination is indicated. Take the blood pressure and the pulse. An abdominal examination should specifically include uterine palpation to assess if there is any pain, masses, or scars. When performing a pelvic examination, explain to the patient what this involves. Check for signs of infection or any abnormalities in the vagina or cervix. Consider starting specific antibiotics if there are signs of sexually transmitted infections after the screening, following local treatment regimens. For the bimanual examination, follow the WHO recommendations and note the size, shape, position, and mobility of the uterus. Assess for tenderness of the uterus on palpation or with motion of the cervix, and or tenderness of the rectovaginal space, cul-de-sac, which may indicate infection. Confirm pregnancy status and pregnancy duration. It is critical to establish the gestational age at this clinical assessment to ensure that the first trimester MVA procedure is appropriate and safe. Gestational age is calculated based on the number of weeks from the first day of the last menstrual period to the present time. Ask about the pattern of her menstrual cycle and whether the last period was normal. Size of the uterus is determined during vaginal examination. This is useful for confirming the calculated gestational age based on LMP. Ultrasound scan can be used if available, if there are other concerns about estimation of gestational age or location of pregnancy, but this is not mandatory requirement. MVA is not indicated for gestation over 14 weeks unless there are dilation and evacuation services available. MVA should also not be used if an ectopic pregnancy is suspected by symptoms or signs. With regard to the investigations before the procedure, routine laboratory testing is not a prerequisite for abortion services, but measuring hemoglobin and hematocrit levels to detect anemia may be useful when initiating treatment in the rare cases of hemorrhage occurring during or after the procedure. Check your local guidelines on anti-D prophylaxis, but testing of RH status should not cause delays to the abortion procedure.